All right, everybody, get ready for a deep dive. Today, we're taking a close look at upper respiratory disorders.
Yep, we've got a whole stack of medical textbooks and research articles here, ready to break it all down.
And the sniffles we all know too well.
To some more intense stuff like laryngeal cancer, tonsillectomies.
Oh, and we can't forget tracheostomy.
Right, we're covering it all.
So if you want to be the most informed person at your next doctor's appointment,
Or just, understand your own body better.
this is the deep dive for you. Let's start with the basics anatomy 101. We're talking sinuses, pharynx, larynx, trachea.
All those parts you've heard of but maybe don't quite picture.
Yeah, like where exactly is the pharynx?
Think of it as the air's pathway from your nose down to the lungs. And remember when doctors check your glands when you're sick?
Oh, yeah, feeling for those swollen lymph nodes.
Right, that's your immune system hard at work fighting off those bugs.
So even a simple cold is kind of complex when you think about it.
Definitely. So let's talk about those common culprits: rhinitis, sinusitis, pharyngitis, basically the cold combo.
Runny nose, stuffy head, the works. But there's a difference between those, right?
Yeah, most colds are viruses, but that sore throat could be strep, which is bacterial. That's why doctors do those strep tests.
Ah, the dreaded throat swab. Not my favorite, but I get why it matters.
Because untreated strep can lead to some nasty stuff like rheumatic fever, which can damage your heart.
Okay, now that's serious. So how do we avoid all this misery?
Well, the research is clear. Hand washing. Simple, but so effective.
Ditch the hand sanitizer and go for good old soap and water.
Yep. It's amazing how much that reduces your chances of catching these bugs.
Speaking of things we might want to wash our hands of, let's talk tonsils and adenoids.
Everyone's had them, but when do they become a problem?
Right, we know they can get inflamed, but then what?
That's when you get tonsillitis or adenoiditis, constant infections, trouble breathing, even sleep apnea.
And sometimes the solution is to just get them out, right? Tonsillectomy, adenoidectomy.
Exactly. And the sources emphasize some important stuff before surgery.
Like what to avoid.
Aspirin's a big one. It messes with blood clotting, so there's a higher risk of bleeding during surgery.
Okay, so aspirin's off the menu. Anything else?
Certain herbal supplements can do the same thing, so tell your doctor about everything you're taking.
Good advice. Now, what about after the surgery? Anything to watch out for?
The research really stresses this. Watch for excessive swallowing. Could be a sign of bleeding, which is bad news.
Makes you think twice about that post-tonsillectomy ice cream, or...
Maybe just a little. But hey, speaking of things that have changed, sinus surgery.
It's not your grandma's sinus surgery anymore, is it?
Nope, not at all. Now it's often done with this minimally invasive procedure called FESS.
FESS, what's that stand for?
Functional endoscopic sinus surgery. Sounds fancy, right?
Kind of. What's so special about it?
They use this tiny camera and instruments go into your nose, and get this, they can do imaging during the surgery.
Whoa, real-time view of your sinuses? That's wild.
It is. Super precise. But even with all that, there are still risks, right?
I was going to say no surgery is completely risk-free.
One that surprised me, a potential cerebrospinal fluid leak. Rare, but it shows that even routine stuff has risks.
Good reminder that it's all serious stuff, even if it's common. Speaking of serious, our sources go into some tougher breathing issues.
Laryngitis, nosebleeds, and the big one, sleep apnea.
Okay, let's tackle them one by one. Laryngitis, that's the voice box inflammation, right? We all get hoarse sometimes, but when is it worrisome?
If that hoarseness sticks around for more than 2 weeks, the research is clear. See a doctor.
So if your voice sounds like a rusty hinge for too long, get it checked out.
Exactly. Could be something more serious, like laryngeal cancer.
Yikes. Okay, noted. What about nosebleeds? Everyone gets those, right? What's the best way to stop them?
Lean forward slightly and pinch those nostrils together, about 10 minutes. And don't tilt your head back.
So pinch, don't tilt. Got it. Now the big one, sleep apnea. It's way more than just snoring, isn't it?
Oh, absolutely. It's when your breathing actually stops and starts during sleep. And it's way more common than people think.
Wow, really? Like, how common?
The research says millions of people have it, and a lot of them don't even realize.
So how do you know if you might have it?
Loud snoring, gasping for air in your sleep, feeling super tired during the day. Those are all red flags.
If any of that sounds familiar, definitely talk to your doctor about a sleep study.
Yeah, those sleep studies, they sound kind of weird, right?
I picture a bunch of people in pajamas, hooked up to wires, trying to sleep in a lab.
Haha, kinda. But it's not bad. They monitor your brain waves, eye movements, heart rate, breathing, all painless.
So like detective work for your sleep, figuring out what's happening while you're out cold.
Exactly. And it's important because untreated sleep apnea can cause some serious problems.
Like what? Besides feeling tired all the time.
We're talking high blood pressure, stroke, heart attack, even heart failure. Not something to mess with.
Okay, that's definitely a reason to take those sleep disturbances seriously. Now, our sources also describe some more intense situations.
Yeah, things like laryngeal trauma, car accidents, blunt force to the neck, situations where the airway gets compromised,
That sounds scary. Like, what kind of impact are we talking about?
One source describes this patient who got hit in the neck during a sporting event. Just the impact caused massive swelling and bruising, made it hard to breathe.
Wow, makes you realize how vulnerable that area is. What are some signs that someone's had laryngeal trauma?
Look for swelling in the neck, bruising, tenderness, any trouble swallowing or speaking, hoarseness.
And what about if they're coughing up blood?
Definitely a bad sign. And if you hear this high-pitched wheezing, it's called stridor. That means the airway is obstructed, which is life-threatening.
So those are all things to take seriously and get help immediately.
Absolutely. Now, what about something a bit more everyday, choking on something?
Oh, we've all had those close calls, right?
Especially dangerous for young kids. The sources emphasize knowing the Heimlich maneuver, it can be a lifesaver.
Everyone should learn it, for sure. But what if the Heimlich doesn't work? Like the object's really stuck.
Then you need a medical professional, stat. They've got special instruments to get that foreign body out.
It's amazing how quickly something seemingly simple can turn serious.
It really is. Speaking of serious, let's talk about laryngeal cancer. This one's a big one.
Definitely a topic that deserves our full attention. What did the research say about the causes?
One thing that stood out was the role of risk factors. Some we can control, like smoking and drinking too much alcohol.
So, quitting smoking and cutting back on the booze can make a big difference.
Huge. But then there are factors we can't control, like family history or exposure to certain chemicals at work.
So, it's a mix of things we can and can't change. What are some early warning signs of laryngeal cancer?
Hoarseness that just won't quit, especially if it lasts more than 2 weeks. Also, any lump or sore in your throat, pain when swallowing, ear pain, trouble breathing.
Sounds like any unexplained changes in your voice or throat warrant a trip to the doctor.
Absolutely. Catching it early is key. The sooner the better.
Makes sense. So, how is laryngeal cancer diagnosed?
Usually with a physical exam, a laryngoscopy to get a good look at the larynx, and a biopsy to test the tissue.
And what about treatment?
Depends on the stage and location of the cancer. Could be surgery, radiation therapy, chemotherapy, or a combo.
So, it really varies from case to case. What happens if the larynx has to be removed completely?
That's called a laryngectomy. It's a big change, but there are ways to speak afterward.
Like what? How do you talk without a voice box?
One way is esophageal speech. You learn to swallow air and use your esophagus to make sounds. Takes practice, but it works.
That's incredible. The human body is so adaptable.
There's also the option of an artificial larynx, a device that vibrates against your neck to make sound.
Oh, I've heard of those. And there's that procedure, what is it, TEP?
Tracheoesophageal puncture? Yep, they make a little passage between the trachea and esophagus, put in a prosthesis, and you can speak using air from your lungs.
So there are options, even though it's a big adjustment.
Definitely, and there are great support groups and resources to help people cope with the changes.
That's good to know. Well, speaking of adjustments, let's talk tracheostomy is a procedure often done after a laryngectomy or when breathing's really compromised.
Right, it's where they create an opening in the trachea windpipe and put in a tube to help you breathe.
So like a bypass for air to get to your lungs, skipping the mouth and nose.
Exactly. And there are different types of tubes depending on the situation.
Like what kinds?
The most common are cuffed and uncuffed. Cuffed tubes have a balloon that inflates to create a seal, so no air leaks out.
And those are used for people on ventilators, right?
Yep. Uncuffed tubes don't have the balloon, so they're for folks who can breathe on their own but need help keeping their airway clear.
So two different tools for different breathing needs. What about caring for a tracheostomy? What's involved?
Keeping it clean is super important. The stoma, that opening in the neck, needs to be washed with soap and water regularly, kept dry, and the skin around it moisturized.
So basically a lot of TLC to prevent infection.
Exactly. And suctioning is key, too, to remove mucus and secretions from the trachea.
Makes sense. Got to keep those airways clear. Anything else about tracheostomy care that people should know?
The research emphasizes keeping the patient's head elevated, especially after surgery.
Why is that?
It helps reduce swelling and promotes drainage, which is good for preventing complications.
So head up for better breathing and less swelling.
Yep. And there's actually a fascinating reason why sitting upright is so crucial. When you're lying down, gravity can pull those secretions to the back of your throat.
And that can lead to what? Aspiration?
Exactly. That's when stuff gets into your lungs instead of your stomach, and it can cause serious problems like pneumonia. Keeping the head up uses gravity to our advantage.
Makes sense. Gravity can be our friend or our foe, depending on the situation. Okay, let's shift gears and talk about intubation and ventilation.
Right, so endotracheal intubation, that's when they put a tube through your mouth or nose down into your trachea.
It's like a direct line for air to get to the lungs, right?
Yep, often used in emergencies or during surgery to help people breathe.
So it's a critical intervention when someone's airway is compromised?
Absolutely. And one of the biggest things to watch out for is the tube becoming dislodged.
Oh, yeah, that sounds dangerous. Why is that so crucial?
Because if that tube comes out, the airway's blocked and the patient can't breathe. It's a life or death situation.
So keeping that tube secure is absolutely paramount.
No doubt. Now, once the tube's in, the patient's usually connected to a ventilator.
That's the machine that breathes for them, right?
Exactly. It takes over the work of breathing, delivering oxygen, and removing carbon dioxide.
It's incredible technology, but I imagine caring for someone on a ventilator is really complex.
It is. Nurses are constantly monitoring, adjusting settings, and making sure the patient's getting the right support. It's a highly specialized area of nursing.
Wow, it's a testament to the skill and dedication of those nurses. But what about communication? How do patients on ventilators express themselves when they can't talk?
That's one of the biggest challenges. Nurses use all sorts of techniques, lip reading, writing, picture boards, even electronic communication devices. It's about finding what works for each patient.
It sounds like a real mix of technical skill and compassion.
Definitely. It's amazing work.
Back again for more respiratory adventures. It's kind of crazy to think about how something as basic as breathing involves so many different parts of our bodies.
It really is. And speaking of different parts, did you know that problems in other systems, like your nerves or even your digestion, can affect your risk of aspiration?
Oh, wow. So it's not just about keeping your airway clear.
Right, it's this whole body thing. But before we go down that rabbit hole, let's get back to those over-the-counter meds we all rely on when a cold hits.
Yeah, those antihistamines, decongestants, cough suppressants, how do they actually work?
Let's start with antihistamines. Remember how we talked about histamine being released during allergies?
Yeah, it's like the body's overreacting to something harmless.
Exactly. Well, antihistamines block that histamine, so you get less sneezing, runny nose, all that fun stuff.
So they're like little bouncers, keeping those histamine troublemakers out of the party.
Ha, I like that. But there are different types of antihistamines, right?
Yeah, I've noticed some make you drowsy, some don't.
Right, the older ones, like diphenhydramine, you might know it as Benadryl, those can make you sleepy because they can cross the blood-brain barrier.
The blood-brain barrier, that's like the shield protecting your brain, right?
Yep. So those older antihistamines get in there, it can make you drowsy.
Ah, so that's why some cold meds knock you out.
Exactly. But the newer ones, like loratadine, Claritin, or cetirizine Zyrtec, they're less likely to cross that barrier.
So if you need to, like, function while you're sick, those are a better bet.
Definitely. Now on to decongestants. They work by shrinking those swollen blood vessels in your nose.
Makes sense. That's what makes it hard to breathe.
Right. But shrinking blood vessels can affect other things too, like your blood pressure and heart rate.
So not something to take lightly.
People with heart conditions especially should be careful with decongestants.
Talk to your doctor first, for sure. Now, what about cough suppressants? Those can be lifesavers when a cough just won't quit.
They work by, well, suppressing the cough reflex in your brain. There are different types, some stronger than others.
And I know some have opioids, which can be addictive.
Right, so definitely use those wisely. Now, if you've got phlegm, you might want an expectorant.
Those are the ones that help you cough stuff up, right?
Yep, they thin out the mucus in your airways, making it easier to get rid of.
So they're like loosening up the gunk, making it less sticky.
Exactly. And for those really tough cases, there are mucolytics. They work even more directly to break down that mucus.
Think of them as like super expectorants, but I imagine all these meds have potential side effects.
Of course, any medication can. That's why talking to your doc is always a good idea, especially if you've got other health issues or take other meds.
Solid advice. Speaking of things to be cautious about, let's get back to nosebleeds. What makes those little blood vessels in our noses so fragile?
Well, the lining of your nose is delicate to begin with, and it's packed with blood vessels.
So it's like a prime spot for bleeding.
Right. Dry air, allergies, even just picking your nose can trigger a nosebleed.
Most of the time, it's no big deal. But when should we worry and see a doctor?
If they're happening a lot or they're really heavy, it's worth getting checked out.
Could be a sign of something else going on.
Right. Could be high blood pressure, a blood clotting problem, even a tumor in the nasal cavity. Those are rare, but it's better to be safe.
Definitely better to err on the side of caution. Now, what about that deviated septum thing? I've heard that can cause nosebleeds.
It can. A deviated septum is when the wall that divides your nasal cavity, the septum is crooked.
So instead of running straight down the middle, it's kind of wonky.
Yep. And that can block airflow, trap mucus, and yeah, make you more prone to nosebleeds.
So one little crooked wall can cause a whole bunch of problems. What can you do about it?
Sometimes, if it's mild, you don't need to do anything. But if it's causing trouble, you can have surgery to straighten it out. That's called a septoplasty.
So they basically go in and fix the wonky wall.
Pretty much. Now, we also mentioned nasal polyps earlier. Those are different from a deviated septum, but they can both block your nose.
Right, the polyps are those soft growths, right?
Yep, they develop in the lining of your nose or sinuses, usually because of chronic inflammation from allergies, asthma, or infections.
Man, those allergies and infections really cause a lot of trouble up there. What are the signs of nasal polyps and how do you get rid of them?
The symptoms are similar to a deviated septum trouble, breathing through your nose, stuffiness, congestion. You might even lose some of your sense of smell.
So if you can't smell your morning coffee, it might be time to see an ENT.
Could be. Treatment depends on how bad it is. Sometimes meds like nasal corticosteroids can help, but sometimes you need surgery to remove the polyps.
Okay, so sometimes meds, sometimes surgery. Now, what about those hypertrophy terminates you mentioned?
Ah, yes, the turbinates. Those are the bony structures inside your nose that warm and humidify the air you breathe.
So they're like little radiators, making sure the air is nice and toasty before it hits our lungs.
Exactly. But sometimes they get enlarged or swollen. That's hypertrophy.
And that's not good, right?
Nope, it blocks airflow, just like a deviated septum or polyps.
So it's like a triple whammy for easy breathing.
You got it. And the symptoms are the same: stuffy nose, trouble breathing.
So how do you fix it? More meds.
Medications can help shrink the swelling, and there's also a procedure called turbinate reduction, where they actually shrink the turbinates.
So if those turbinates are getting too big for their britches, they can shrink them down.
Exactly. Now, we've been talking about septoplasty and turbinate reduction. What about rhinoplasty? Isn't that just a nose job?
Yeah, I thought that was purely cosmetic.
It often is, but it can also be done to fix functional problems, like a deviated septum.
So you can improve both your breathing and your looks.
Two birds, one stone. But of course, any surgery on the nose has risks.
Like what? Besides the usual infection risks?
One that surprised me was the potential for a cerebrospinal fluid leak, or CSF leak.
CSF leak. Sounds kind of scary. What is that?
CSS is the fluid that cushions your brain and spinal cord. If there's a tear in the membranes that hold it in, it can leak out, and that can lead to infection.
So that's definitely something to watch out for after any nasal surgery.
For sure. Always better to be safe than sorry. Speaking of safety, let's talk facial trauma. I mean, these injuries can be anything from a little cut to a major fracture, right?
Yeah, I'm thinking car accidents, cars, sports injuries. Those can be pretty rough.
Absolutely. The first thing is making sure the airway is clear and controlling any bleeding.
Airway, breathing, circulation, the OBCs of emergency care.
Exactly. Once the patient is stable, then they can assess the extent of the injuries.
Lots of x-rays and CT scans, I imagine.
Yep. Then the treatment depends on what they find. Could be just cleaning and bandaging a wound, or it could mean surgery to fix broken bones.
It's amazing how well the body can heal, but it's also a good reminder to take precautions and avoid those injuries in the first place.
Totally agree. Seatbelts, helmets, all that good stuff. Now let's switch gears a bit and talk about peritonsillar abscess. This one sounds pretty nasty.
Peritonsillar abscess. What is that exactly?
Imagine a big pocket of pus forming near your tonsils, like a giant pimple in the back of your throat.
Ouch. That sounds incredibly painful.
It is. Makes it hard to swallow, talk, even breathe. It usually happens after tonsillitis, often a strep throat infection.
So if your sore throat is just excruciating and you're really struggling to swallow, it might be more than just a cold.
Exactly. Don't wait to see a doctor. Treatment usually involves draining that abscess and antibiotics to fight the infection.
So basically, drain the giant throat pimple and kill the bacteria. Makes sense. Now, how about laryngoscopy? That's a procedure used to diagnose and treat a bunch of different things, right?
Yep. It lets the doctor see your larynx or voice box using a little scope with a light on it.
I'm picturing them sticking that down your throat. Is it painful?
It can be a little uncomfortable, but they usually try to make it as quick and painless as possible.
So they use it for diagnosing things like laryngitis, vocal cord problems.
Right, and even laryngeal cancer. They can also use it to remove foreign object or take biopsies.
So it's a versatile tool. Now, what about vocal cord paralysis? That sounds scary.
It can be. It's when one or both of your vocal cords can't move properly.
So instead of vibrating to make sound, they're kind of stuck.
Exactly. And it can be caused by all sorts of things: nerve damage, trauma, tumors, even some viruses.
Wow, so many things can affect those tiny little cords. What are the signs of vocal cord paralysis?
Hoarseness is the big one, but you might also have a weak voice, breathiness, or trouble swallowing.
So if you sound like a croaking frog for more than a few weeks, see an ENT.
Good analogy. They can figure out what's causing the paralysis and talk about treatment options, which might include voice therapy or even surgery.
Okay, so depending on the cause, there are different ways to address it. Now, let's talk sleep again. Specifically, sleep apnea. We touched on it earlier, but I want to dive a little deeper.
Sleep apnea is a serious sleep disorder where your breathing keeps stopping and starting while you sleep.
But it's more than just snoring, like actual pauses in the breathing.
Yep. It can happen dozens or even hundreds of times a night, and you might not even know it's happening.
No wonder people with sleep apnea are so exhausted. What causes those breathing interruptions?
The most common type is obstructive sleep apnea, or OSA. That's when the airway gets blocked, usually by the soft tissues in the back of your throat.
So like the muscles relax during sleep and those tissues just flop back and block the airway.
Exactly. There's also central sleep apnea, or CSA, which is less common. That's when your brain doesn't send the right signals to your breathing muscles.
So it's a brain messaging problem, not a physical blockage.
Right. And some people have a mix of both, called mixed sleep apnea.
Okay, so 3 different types, all with the same basic problem, interrupted breathing during sleep. Now, I've heard that being overweight is a big risk factor for sleep apnea.
It is, especially for OSA. Extra weight can put pressure on the airway, making it more likely to collapse.
So maintaining a healthy weight is important for preventing sleep apnea.
Absolutely. Other risk factors include a large neck, a naturally narrow airway, a family history of sleep apnea, and smoking.
And if you do have sleep apnea, ignoring it can lead to some serious health issues, right?
Yep, we're talking high blood pressure, stroke, heart attack, diabetes, depression. It can even make you more likely to have accidents because you're so tired.
Okay, those are some pretty compelling reasons to take sleep apnea seriously. So what should you do if you think you might have it?
Talk to your doctor. There are tests they can do to diagnose it, and thankfully, there are treatments too.
Like what?
Lifestyle changes can help losing weight, avoiding alcohol before bed, and then there's CPAP therapy.
CPAP, that's the one with the mask, right?
Yep, it stands for Continuous Positive Airway Pressure. The mask delivers a steady stream of air, keeping your airway open all night.
So it's basically like a gentle splint for your airway.
Exactly. It can take some getting used to, but it works really well. If CPAP doesn't work, there are other options, like oral appliances or even surgery.
So there's hope. You don't have to just suffer with sleep apnea. Now, let's move on to something that can be pretty scary, laryngeal cancer.
Laryngeal cancer affects the larynx, or voice box, which is basically what lets us speak. The biggest risk factors are smoking and drinking a lot of alcohol.
So those are two big things people can change to lower their risk.
Absolutely. Quitting smoking and cutting back on alcohol can make a huge difference. There are other risk factors too, though, like being exposed to certain chemicals at work or having a family history of head and neck cancers.
So sometimes it's genetics, sometimes it's lifestyle. What are some warning signs that people should watch out for?
Hoarseness that lasts more than 2 weeks is a big one. Also, any lump or sore in the throat, pain when swallowing, ear pain, trouble breathing.
Sounds like any unexplained changes in your voice or throat warrant a trip to the doctor.
You got it. Early detection is key with this one. They'll usually do a physical exam, a laryngoscopy to see the larynx, and a biopsy to test the tissue.
Okay, so multiple steps to get a clear diagnosis. What are the treatment options for laryngeal cancer?
It all depends the stage of the cancer, the location. Treatment can include surgery, radiation therapy, chemotherapy, or a combination.
So it's a tailored approach based on the individual case. Now, what happens if they have to remove the larynx completely?
That's called a laryngectomy, and it's obviously a major adjustment. But there are ways to speak after having your voice box removed.
Like what? How do you talk without a larynx?
One way is esophageal speech. Basically, you learn to swallow air and use your esophagus to create sound. It takes practice, but it can work.
That's amazing. The human body is so resilient. Are there other options?
Yep, there's the artificial larynx, a device that vibrates against your neck to make sound. And there's a procedure called tracheoesophageal puncture, or TEP, where they create a small opening between the trachea and esophagus and insert a prosthesis that lets you speak using air from your lungs.
So even though it's a big change, there are ways to adapt and communicate.
Absolutely. And there's great support out there for people who've had a laryngectomy, support groups, therapists, all sorts of resources to help them navigate the challenges.
That's really good to hear. Now, speaking of procedures that can be life-changing, let's talk about tracheostomies.
A tracheostomy is where they create an opening in the trachea, or windpipe, and put in a tube to help you breathe. It can be temporary or permanent, depending on the situation.
So it's basically a bypass for air to get to the lungs, skipping the mouth and nose.
Exactly. It's often done in emergencies, like when the airway is blocked due to an injury or allergic reaction. But it can also be used for people with chronic breathing problems, like laryngeal cancer, sleep apnea, or vocal cord paralysis.
So it's a pretty versatile procedure. You mentioned different types of tubes. What are those?
The most common are cuffed and uncuffed. Cuffed tubes have a balloon that inflates to create a seal, preventing air from leaking out around the tube.
And those are used for people on ventilators, right?
Yep. Uncuffed tubes don't have the balloon, so they're for people who can breathe on their own but need help keeping their airway clear.
Okay, so two tools for different breathing needs. What about taking care of a tracheostomy? That sounds pretty involved.
It is. Keeping it clean is crucial. You got to wash the stoma, the opening in the neck, with soap and water regularly, keep it dry, and moisturize the skin around it.
Sounds like a lot of TLC to prevent infection.
Exactly. And suctioning is important, too, to remove mucus and secretions from the trachea.
Right. Got to keep those airways clear. Any other tips for tracheostomy care?
The research really emphasizes keeping the patient's head elevated, especially after surgery.
Why is that so important?
It helps reduce swelling and promotes drainage, which helps prevent complications.
Okay, so head up for better breathing and less swelling. Now, let's talk about a procedure that's often used when someone can't breathe on their own, endotracheal intubation.
Endotracheal intubation, or intubation for short, is when I insert a tube through the mouth or nose and down into the trachea, creating a direct pathway for air to get to the lungs.
So it's a pretty crucial intervention in emergencies.
Absolutely. It's often used in situations like cardiac arrest, respiratory failure, or severe trauma.
It sounds pretty intense. What are some of the challenges involved in performing this procedure?
It requires a skilled medical professional who can quickly and accurately assess the airway and insert the tube without causing any damage.
So it's a high-stakes procedure that demands precision and expertise. Now, what happens once the tube is in place?
The patient is usually connected to a ventilator, which is a machine that breathes for them.
So the ventilator takes over the work of breathing, giving the patient's body a chance to rest and recover. What's it like caring for a patient on a ventilator?
It's a complex and demanding task that involves constant monitoring of vital signs, breathing patterns, and blood oxygen levels. You're constantly adjusting the ventilator settings to make sure the patient's getting the right support. It's a highly specialized area of nursing.
It sounds like a really challenging but rewarding job.
It definitely is. It's amazing to see the impact these nurses have on their patients' lives. But communication can be a big challenge, especially when the patient is sedated.
Yeah, how do patients on ventilators communicate their needs and feelings if they can't talk?
Nurses use all sorts of techniques, lip reading, writing, picture boards, even electronic communication devices. It's all about finding creative ways to bridge that communication gap.
It's inspiring to see the dedication and compassion these nurses show in those situations.
It really is. They're true heroes in healthcare.
Well said. We've covered a lot of ground in the second part of our deep dive, everything from over-the-counter cold meds to complex procedures like tracheostomies and ventilation.
We've learned about a wide range of upper respiratory disorders, their causes, symptoms, and treatments.
And we've seen how lifestyle choices, genetics, and even simple accidents can all play a role in respiratory health.
But the good news is, there's a lot we can do to protect our respiratory health and seek treatment when needed.
Absolutely. Knowledge is power, and understanding how our bodies work is the first step towards taking good care of ourselves.
Couldn't agree more.
And we're back. It's wild to think we started with the common cold, and now we're talking about life-saving interventions like intubation.
Yeah, it's a pretty dramatic contrast.
Speaking of dramatic, let's revisit endotracheal intubation. We left off talking about how crucial it is to monitor that tube.
Oh, absolutely. If that tube comes out, it's a huge problem.
The airway's blocked, no oxygen getting to the lungs.
Life-threatening situation for sure.
So much emphasis in the research on securing that tube properly.
And for good reason. Now, once the tube's in, the patient's often hooked up to a ventilator.
Right, the machine that breathes for them.
Exactly. Delivers oxygen, removes carbon dioxide. Pretty incredible technology when you think about it.
It really is, but I can only imagine how demanding it is to care for someone on a ventilator.
Oh, it's intense. Constant monitoring, adjusting settings, dealing with any issues that pop up. It's a whole specialized area of nursing.
The research really highlighted the skill and dedication of those nurses.
For sure. They're making a huge difference in people's lives. But one thing that always comes up is communication.
Yeah, how do patients on ventilators communicate if they can't talk?
That's the tough part. Nurses get creative lip reading, writing, picture boards, even electronic devices. It depends on the patient and the situation.
It's amazing how they find ways to connect, even when it's so difficult.
It really is. Well, we've covered an incredible amount of ground in this deep dive, haven't we?
From sniffles to serious procedures, it's been quite a journey.
We started with the basics of the upper respiratory system.
Explored all sorts of conditions, from the common cold to laryngeal cancer.
Talked about medications, surgeries, even life support.
And through it all, we've tried to emphasize the things you can do to stay healthy.
Like that simple but crucial hand washing.
Right, and being aware of the risks, like avoiding aspirin before surgery.
Exactly. Knowledge is power when it comes to your health. We hope this deep dive is giving you a better understanding of your own respiratory system.
And empowered you to ask questions and advocate for yourself.
If you have any concerns, don't hesitate to talk to your doctor.
They're there to help you breathe easy, literally.
That's a good one.
Thanks for joining us on this deep dive. We'll see you next time for another fascinating exploration of the human body.
Until then, stay curious and stay healthy.